of my daughter. When she was 7 or 8 years old, her best friend Bridget, every time the teacher said we're gonna have a test, she would panic. She couldn't sleep, she cried, and carried on, until one day the teacher said, well, I'm gonna change the name. I'm gonna call it a pickle. So next Wednesday, we're gonna have another pickle. Bridget was fine. And actually, Bridget grew up and is a hardworking veterinarian right now. So I don't have the ideal word for marijuana, but let's kind of think of it as a pickle. In fact, like a pickle, there are no side effects other than maybe being a little bit happy when you use it medicinally. You can use it recreationally, you shouldn't, but can use it recreationally, but still there's no overdose. Worst comes to worst, you relax and go to sleep. It does not interact with any other medications. There's no withdrawal if you use it for a long period of time and then suddenly stop. Nobody has died from marijuana overdose. People die every single year from vitamin overdoses, let alone all the other medications out there that treat you for pain, or psychiatric reasons, or musculoskeletal reasons, what have you. So though marijuana, cannabis is a scary term, when you think about it, it's pretty benign.
So what does it do to your body? How does it help your body?
Well, I'll answer that right now. That's part of my talk. What it does, well, let me digress for a second. In the body, we are born with receptors to cannabinoid substances, just like we've learned over the past 30 or 40 years that there are receptors for opiates. And we make our own opiates inside our bodies, like when you jog or you do something, and that sometimes makes us feel happy, just like how thyroid hormone binds to a receptor on a cell and acts, or insulin binds to a cell and it absorbs sugar. In fact, adult onset diabetes is more or less a receptor problem. There's plenty of insulin around, the receptors aren't working. Our body makes substances like cannabinoids, and in fact, in most lower animals, they have it also. We don't understand that at all. It was only discovered a couple of decades ago by a couple of researchers in Israel, but we know nothing about it. So fundamentally, we know that the body is set up to receive messages from cannabis that we bring from the outside. It just is. From a personal level, I think what cannabis does to me is, yes, there are pain effects and it dulls it a little bit, but interestingly, and the way it helps me with the pain and the way I could sleep, is that it dissociates the oomph from the pain. So it's as if I know that I got something going on in my feet or my back, but it doesn't bother me. So if I have back problems and I move around, it's not going to make it worse. You know, anatomically, the damage has been done to the nerves long ago. There's no bulging disc that I can make worse. There's no bone spurs that I can make worse, but you have the pain. So if my wife says to me, Andy, do you feel pain? I say, yeah, but it doesn't bother me. So I think part of the mechanisms with many, many diseases is that it dissociates the harmful effect of a muscle spasm or depression or PTSD and so on and so forth. Now that's completely non-scientific. That's based upon my own experience in talking to 5,000 patients. Now sometimes people tell me it completely removes my pain. It completely removes my shakes if I have Parkinsonism. It completely removes the night tremors or what have you from PTSD. So there's a lot of variability. And so as a doctor scientist, I have to say, I don't really know. Medical marijuana is an art. It's not much of a science.
So you're tricking the brain, is what you're doing.
You might be doing something like that, absolutely. But at the same time, on the muscles, on peripheral nerves, there are receptors. And I know that we as human beings, we like a quick answer to things. Particularly, I'm a surgeon. I'm a Mr. Fix-It. If there's a problem, I want to fix it right away. I don't know the answer now. There are some studies that are coming out right now where they're looking at it scientifically. For example, we know exactly what happens at nerve endings, the chemical pathways. There are some medications that block this, and there have been attempts to utilize this, such as for weight loss, because we all know that certain kinds of marijuana make us a little bit more hungry. In fact, that's why cancer patients use it, or inflammatory bowel patients do it to gain weight. So the thought is that if we could find something to block that, maybe that's the miracle cure for obesity. So far, things haven't panned out, but sometimes that's the way it is. In fact, with a lot of the commonly used drugs, like Pepcid and Sintagament and all those kinds of things, I mean, I heard about those things 30 years before they became products. All these things that we're using now were in the lab when I was in medical school in the late 70s. So it takes time. So what does that mean for us, individually with our particular disease? It's like the old expression, try it, you'll like it. And if you don't like it, you've wasted some medicine. In fact, we have a certification thing where it's much less to be certified, and we just give you a month's worth of prescription. So you could try and see if you like it without going through the entire expense of it. But remember, this is not for somebody that's got a little problem. This is for somebody who was like me, kind of at their wit's end. I think as time goes on, the indications will be broader and broader. For example, nationwide, the #1 reason why people use it is simply for anxiety, as opposed to using benzodiazepines or other kinds of tranquilizing medications. We're at the beginning of a new evolution in taking care of ourselves, and part of that involves us taking care of ourselves. Because you know that if you go into the medical system, you might or might not see a doctor after you've waited a long time for an appointment. They'll spend a short period of time with you, and it might even be just the nurse that'll say, here's the pill. And so they're going to hand out medications such as a family practice kind of guy that's treating severe psychiatric problems with very, very little training other than their HMO telling them that they have to not send to psychiatry, it'll be reduced payments to them. So they'll give you something and they won't hear from you because it's hard to get through to that doctor. And then you'll come back and you say, I've had terrible side effects or whatever, and then they'll switch you to something else or add something else. What people are really going to do is, with our guidance, start to self-treat. Because you know what's best for you, you know what's working with you. Cannabis, marijuana has a very, very low profile in terms of warnings, and so you're the judge of that.
What do you mean warnings?
Well, most drugs have warning. Most medications have warning.
Oh, warnings on like the bottle.
Yeah, on the box. There's almost nothing to write. I mean, if you abuse the drug and you drive, you'll cause an accident. And if you fail the field sobriety test, you should face the consequences. The same thing people were always asking, well, will it affect my permit to carry? It's not a big issue in Massachusetts, but as part of my company, we work with a regulatory attorney in Tallahassee who was on the board of medicine and the board of health when they wrote the laws. And so we run things by him, as we run by all our processes and procedures. And we've asked that question, and the answer is no, it doesn't affect it. That being said, if you are under the influence and you go in your backyard and shooting off a rifle, you will and should get prosecuted for that. But what I'm saying is that you don't see those side effects like interactions with medication, itchiness. In fact, the only problem that you ever see with medicinal marijuana is in, and we've seen it in young males who use it recreationally, and they develop a symptoms where they have constant nausea, vomiting. And it's not understood exactly why, but the treatment of that is just stop using marijuana, it goes away. So that's basically it. There's really no need for any black box warnings. If there were, then no state would really allow it to be used, because as a doctor, first do no harm. So that's why we're here to sort of change your perception of what medical marijuana is. Now, within the marijuana, there are 85 different substances. One thing that we hear about a lot is CBD. It's all over the news. You could get it from your chiropractor, you could get it from lots of different places. Based upon what I read scientifically and governmentally, and what I've seen in the thousands of patients that I've treated, what you buy outside of a dispensary is more or less snake oil. The FDA has looked at a lot of these companies, and as there's no regulation, there might not be any CBD in it at all, even though they claim that it's 10%. Or it might have been extracted in such a way that, yeah, you have the CBD, but it's not biologically active.
So what does CBD stand for?
Cannabidiol. It's a chemical, just like THC, tetrahydrocannabinol. There are 85 different substances. So that's what CBD is, one of the substances. Now, if the advantage of CBD worked, there are no of the mental changes whatsoever. You don't feel anything. Now, my patients who get their CBD from a dispensary, that's a little bit better. The CBD that you could buy online or in stores or without certification is made from the rope hemp plant. It's not made from the marijuana plant. The CBD that comes from a dispensary is made from the marijuana plant. And there is some THC in it, which is a psychoactive ingredient, plus the 80 some odd other substances that we haven't characterized yet.
So the CBD with the hemp is not as good?
I think it's basically worthless. I would say maybe a few percentage of people, because everybody that walks into my office has this little bottle, and I've
says CBG
spent,
hemp.
yeah, and I've spent $90 on it, and it really doesn't do that much. Very, very rarely I see somebody that says this has been great for me. Now, either one, it might be great for them because of their biology, or number two, there's a placebo effect. In other words, if you give for a pain medicine 100 people sugar water and they don't know, 10 or 15% are going to say this makes me feel better. That's probably a mind-body connection. You're willing the brain to make it better. And that's the hemp. The CBD has some of the substances over, but in low concentrations. And as much as 20 or 30% of people have said that it's very helpful. So I encourage all my patients to try it at least, because worst comes to worst, you pay, $20, $30 for the pills and you've wasted it, but the benefits of something like that are tremendous. Now, I will also tell you that a lot of the perceptions in Florida come from marketing. I have heard that 50% of the revenues at dispensaries in Florida come from sales of dispensaries, Now, if you look in Massachusetts and California, two states where you have recreational marijuana, so the people going in primarily for medicinal reasons, and they've been there for 8-10 years, less than 5% of revenue comes from CBD. So to me, I interpret that, and people can interpret it differently, but my interpretation of that is that's a large population who has tried the CBD and it doesn't seem to help. That being said, I do encourage people, when I do write the certification order, I add a significant amount of CBD because you never know. It's not gonna hurt you, it's not gonna cost you any more money.